Diarrhea can feel like the drug is failing. It usually is not. On Zepbound or Wegovy, loose stool often means the drug changed digestion, and your meals, fluids, and dose timing no longer match. Most cases get better when that mismatch is fixed. The bigger mistake is assuming diarrhea automatically means the drug is too strong or too dangerous. Most people expect constipation on these drugs. Then diarrhea shows up instead, and the whole thing feels backward. These drugs slow the stomach, but the bowel can still react badly later. That is why a slower gut can still end in loose stool. Before you decide how worried to be, ask a simpler question. What changed first? Was it the dose, the meal, your fluids, alcohol, or the timing of how you ate that day? That sequence matters more than the drama of the symptom itself. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Wegovy and Zepbound change how food moves through the gut. They slow how fast the stomach empties and can also change how the bowel reacts when food finally gets there. One slow step does not make the whole system slow in the same way. Food may sit longer in the stomach. Later, it can still reach the intestine in a way that triggers loose stool, urgency, or cramping. That is why some people get diarrhea even while they also feel full longer. It sounds contradictory, but it is really a timing problem. This is why the symptom can feel random when it is not. You may eat something at lunch and feel the effect much later. That delayed reaction makes people blame the wrong meal, the wrong dose, or even the wrong day. Dose changes matter early. If diarrhea starts right after a dose increase, that timing already tells you something useful. The gut is reacting to a stronger effect before it has fully adapted. That is different from the drug suddenly becoming dangerous overnight. Not every loose stool means the drug is no longer a fit for you. Sometimes it means the dose jump was too fast. Sometimes it means the meal pattern became too chaotic for a gut that is already moving differently. Food choices matter just as much. Greasy meals, very large portions, alcohol, and a lot of sugar can all hit harder on these drugs. The meal may not look huge, but if it is rich and hard to process, the bowel may react fast with urgency, cramping, or diarrhea. Hydration also gets misunderstood. Yes, diarrhea can cause dehydration, but low fluid intake can also make the whole situation feel worse from the start. When people eat less, drink less, and then lose more fluid, weakness and dizziness join the party very quickly. One common habit can make this much worse. Some people eat almost nothing for hours, drink very little, and then try to catch up with one rich meal later. That pattern can turn a mildly irritated gut into full diarrhea. People often blame the drug alone, even though their eating pattern is also driving the symptom. That matters because the fix changes. If the pattern comes from long gaps or heavy late meals, lowering the dose is not always the first move. Sometimes the first move is smaller meals, steadier fluids, simpler foods, and a slower eating pace. That is less dramatic, but it works better. A different pattern deserves more attention. Loose stool after a heavy dinner is one pattern. Loose stool that wakes you up at night or follows a whole day of poor intake deserves more respect. The first pattern is often a trigger problem. The second raises the dehydration stakes. Misreading the cause also leads to misjudging the severity. Weight loss makes some people tolerate symptoms they should not tolerate. If the scale is dropping, they may tell themselves the diarrhea means the drug is working. That idea is convenient, memorable, and wrong. Diarrhea is not a bonus fat-burning setting. It is a side effect. It can be mild and temporary, but it does not deserve a trophy. If you are getting weaker, more dizzy, or unable to eat and drink normally, admiration for your discipline is the wrong response. Most people treat every episode the same way. That is the mistake that keeps the cycle going. Severity matters more than annoyance. One loose stool after a trigger meal is very different from repeated watery diarrhea all day. Mild symptoms usually mean you can still drink, still function, and still identify a likely trigger. More serious symptoms mean the problem is starting to outrun your ability to keep up. Stool frequency helps, but context matters more. 3 loose stools after a greasy meal is one pattern. Repeated watery diarrhea all day, especially with poor intake or overnight symptoms, is a different problem with a higher dehydration risk. More urgent signs include standing dizziness, trouble keeping fluids down, fever, blood, black stool, or severe pain. Nighttime diarrhea also deserves more caution because it may not be just one bad meal. Those features push the situation out of the manageable category. Not every case is from Wegovy or Zepbound. Viral illness, food poisoning, magnesium, antibiotics, metformin, lactose intolerance, and gallbladder trouble can overlap. If symptoms start after months of stability or after travel, widen the list before blaming the injection. Keep the response boring. Eat smaller meals, lower the fat load, and sip fluids steadily. Avoid alcohol if it clearly worsens the pattern. Electrolytes can help because they support fluid balance. Contact your clinician sooner if diarrhea keeps returning after each injection or lasts longer than expected. Contact them urgently if there is blood, black stool, fever, severe abdominal pain, fainting, repeated vomiting, or clear signs of worsening dehydration. Another common mistake is changing everything at once. Keep the dose day the same, keep meals simple, and write down what actually happened. Track the injection date, the dose, what you ate, and how many loose stools happened. Also note dizziness, vomiting, or fever. Bring that note to the visit if you need help. It helps you see patterns faster. It also helps your clinician decide whether this looks like a meal issue, a dose issue, dehydration, infection, or something else. One last point matters. Do not use weight loss as proof that the symptom is acceptable. Weight can fall while your fluid status gets worse. That is not a sign of success. It is a sign that the scale and your health can move in opposite directions for a while. The key point is simple. Diarrhea on these drugs usually happens when your food timing, meal pattern, fluids, and dose changes stop lining up. Most mild cases improve when you fix the trigger and give the body time to adapt. Your bowel is not betraying you. It is telling you that your meals, fluids, and dose timing are out of sync. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.